My name is Raynon Andrews. I'm a family medicine physician here in Huntsville, Alabama. I've been practicing primary care here in the Huntsville area since 2004. I'm excited to talk to you today about what it means to be immunocompromised and what are the populations that I see in my office that are considered to be immunocompromised. First of all, what does it mean to be immunocompromised? A person is said to have an immune deficiency or be immunocompromised when their immune system is incapable of working to full capacity. The immune system fights off diseases for the body, and that's how the body protects itself from infections. There are several conditions that can cause your body to have problems with immunity. Number one, which is well known, is AIDS, acquired immunodeficiency syndrome. This is a result of the HIV virus, and in its last stages, it manifests as AIDS, which is a deterioration of the immune system when the body is no longer capable to defend itself. This is a population of patients that are very, very high risk, and their cause of death is usually due to some type of infectious disease, pneumonia, for example. Another reason patients can be considered immunocompromised is due to chemotherapy. Chemotherapy not only kills the cancer cells, but it also kills the living cells and are good, healthy living cells that are used to fight infection. So patients who are on chemotherapy can be considered immunocompromised. Cancer. Cancer patients, those who have leukemia or lymphoma, those patients have a condition where the bone marrow gets disrupted from making the cells that the body needs to fight infection. So cancers can cause a person to become immunocompromised. Not all cancers, but certain cancers. There are also autoimmune diseases that can cause patients to be immunocompromised. Lupus, rheumatoid arthritis, and there are medicines for psoriasis and Crohn's disease that are called tumor necrosis factor inhibitors. They can cause patients to be immunocompromised. Also, other medications that can cause patients to be immunocompromised are steroids. If someone is on prednisone for a long period of time, or certain anticonvulsants for a long period of time. There are some chronic diseases which we'll get into a little later, which can cause a patient to have a weakened immune system, such as diabetes. We'll talk about diabetes a little more later because I see a lot of diabetes in my office. Some of the other common conditions are kidney disease and also hepatitis and alcoholism. There are some congenital defects that can cause patients to be born with a weakened immune system. So those patients need to be protected from other infectious diseases. And then lastly, aging. Aging is a reason to have a weakened immune system. As we get older, our immune system loses its memory, and infections that we've had before, we are now can be susceptible again. All right, so diabetics, why are they considered to be immunocompromised? Well, there are several reasons that a diabetic can be considered to be immunocompromised. The first of those reasons is when the body encounters a high blood sugar, that environment becomes toxic to the cell. It becomes very acidic, especially in conditions like diabetic ketoacidosis. In that environment, our cells that fight infection do not work well. This is a reversible cause, though, because once the blood sugar is lowered and that high acid environment is reduced, then the immune system can function better, okay? Secondly, a high blood sugar causes our blood flow to be diminished. It causes it to slow. So, for example, in the extremities of a diabetic person, a slowing of perfusion causes those nerves now to die, okay? So you have a decreased blood flow, and then you have decreased sensation. So that a diabetic, if they have a break in their skin, they may not feel it, but the infection can start brewing. It can go from the skin to the tissue and to the bone, And if those nerves don't tell us, the nerves that tell us, hey, there's pain, there's infection going on, if they don't feel that, they can go on for days, weeks, months without knowing that there is an infectious process going on. So those are the two main mechanisms that cause diabetics to be at high risk. Thirdly, high blood sugar limits the production of our white blood cells and the substances that our white blood cells use to fight infection. So it, number one, stops the blood cells from being produced, and there are some white blood cells called phagocytes. They are not able to do their job, which is to eat bacteria or viruses. It's not able to do that well in an environment of high blood sugar. There is also a compound produced in diabetics called dicarbonyls. And this compound that they find, it inhibits the infection-fighting proteins in our bloodstream. So there's research going on now how to combat those substances, because that can be a way to help diabetics conquer infection. In this environment, we're talking about COVID-19, and we've seen in the news that hypertension patients are at risk. There seems to be some association between hypertension and COVID-19 disease. This may be, hypertensive patients may be more likely to get COVID-19. They may have worse symptoms when they do get the COVID-19, and they may also die from infection more than others. The research is still ongoing, but they're finding some type of link between hypertension and COVID-19 complications. And here's a couple of theories that are out there. Long-term health conditions somehow seem to weaken the immune system, hypertension being a long-term health problem. They're seeing in China and also in Italy that the majority of patients who came in who experienced complications had hypertension, along with some other problems like diabetes or heart disease. Another possibility is that the COVID-19 virus attaches to the angiotensin coenzyme inhibitor pathway. And patients who are on medicine for high blood pressure, they are usually on angiotensin converting enzyme inhibitors, which increase the level of angiotensin converting enzyme. So they're thinking that somehow there's an interaction between this pathway and the COVID-19 virus that causes an increased susceptibility of these patients. But it's still being researched and still being looked at. Again, the theory is based on the fact that ACE inhibitors and angiotensin receptor blockers raise levels of an enzyme called angiotensin converting enzyme 2 in the body. And to infect cells, the COVID-19 virus must attach itself to the angiotensin enzyme 2, angiotensin converting enzyme 2. So I hope you got all that. Until more research is done, cardiologists are encouraging patients, don't stop your ACE inhibitors or angiotensin receptor blocker medications. They're not sure of what the link is, but patients who have high blood pressure usually have some degree of heart disease, and COVID-19 is ravaging patients who have heart disease. So if your heart is somewhat weakened already through hypertension, then you can be more susceptible to the complications of the COVID-19 virus. So what I wanted to end with is just a text, Philippians 4:6. It reads, "Be anxious for nothing, but in everything with prayer and fasting, make your requests known to God." I like how the New Living Translation says it. It says, don't worry about anything. Instead, pray about everything. Tell God what you need and thank Him for all He has done. In this time of great worry and anxiety, we have to be thankful for what God has done for us in the past, because we see what He can do. So we have to rest and trust on what He's already done in the past. That will help us looking forward. And if God was able to conquer death, He can help us through these times and help us to be fruitful, help us to live on less, help us to have peace, help us to have more prosperity than we experienced before. Not maybe financially, but maybe spiritually. God bless you, and stay healthy.